Hello and welcome back to my channel, Dental Hygiene with Whitney. Today I did something very exciting. I brought my camera to work. So my coworker slash friend, she was really nice and let us film her cleaning appointment. I'm very excited to show and explain kind of all the ins and outs of what goes on during a dental cleaning routine exam every 6 month type thing. She done. Without further ado, here is what to expect at a routine cleaning appointment. First, you'll most likely be greeted in the waiting room. The hygienist usually calls your name and brings you back to the room. Next, they'll usually place the bib on you and ask how your day's going, some small talk, how's the weather, things like that. They will go over any changes in your medical history, any new medications, things like that. They'll also ask how your teeth are feeling, if anything's bothering you, or if you're just here for a routine cleaning and exam. Next, they will let you know if you are due for x-rays today. Bite wing x-rays are generally taken about once a year. Here is the sensor used for digital x-rays. Bite wing x-rays are just 2 pictures on each side of the mouth, and they specifically check for cavities, tartar, and the level of the bone. Sometimes if you have a high cavity rate or your bone is being monitored, these may be taken at every cleaning appointment. Here you can see a little closer up on how we put those in your mouth. I know they're not the most comfortable things, but ooh, look at that good picture. That was a good premolar shot. Okay, so every 3 to 5 years, they may take some routine full mouth x-rays, FMX. These ones are checking the roots of every single tooth, all the front teeth and all the back teeth. About 18 images are taken in a full mouth x-ray. You can kind of see here how you can see the roots of the tooth inside the bone there. It is possible your dentist will want to take a panoramic x-ray, which is shown here at the 3 to 5 year mark. These are generally taken to examine the wisdom teeth or the jaw, TMJ, or other surrounding structures. Next, before you're cleaning, we need to check your gums about once a year. We use a little ruler called a perio probe, which takes measurements of your gums in millimeters. Basically, there is a natural space between your gums and your tooth. We measure in that space to check the height of the bone and the surrounding tissues. Healthy tissue is between 1 and 3 millimeters. So 1s, 2s, and 3s are considered within normal limits. 4s are considered borderline, possibly an area of inflammation or tartar, and the number 5 and up often indicates bone loss or gum disease in that area. We check these numbers once a year to confirm your gums are healthy and happy. As you can see here, oftentimes these numbers are recorded in your chart for comparison throughout the years. The black numbers 1, 2, and 3 are healthy, and the red numbers 4 and up show areas to be monitored, things like that. One more thing before we jump into the cleaning. Oftentimes the hygienist and or dentist will do an oral cancer screening. Basically, they will check the lateral sides of the tongue, underneath the tongue, the insides of your cheeks, the inner lips, and the back of the palate and throat for any suspicious lumps or bumps. Now it's time to get that tray ready for your cleaning. The reason you are here, you want clean, shiny teeth. First, a lot of times we start with an ultrasonic scaler, either called a piezo or a cavitron. We clean around each tooth with this instrument first, which takes off most of the tartar, stain, and plaque very well. The combination of ultrasonic vibrations on this instrument and the flushing of the water cleans the teeth very well. The suction will be in your mouth the whole time. It's a lot of messy water. It's not quite the spa, but we do what we can. Next, the hygienist may blow some air on your teeth and then start scaling with hand instruments, the instruments that make the scraping sounds. The drier the tooth, the easier it is to see any residual tartar upon the surface. After the teeth are smoothened out with the scalers, It is time to polish. There are two ways to polish. One way is with a polishing cup and paste, as seen here. Today, our patient chose strawberry flavored paste. Basically, the goal of polishing is to remove stain and smoothen the tooth surface so plaque is less likely to attach. Now, just for the sake of this video, I'm pretending to air polish. This is the other way you can polish teeth. I don't use this often, it's very salty and messy for me, but some people love it. We are just pretending here. If we were really air polishing, she would be wearing protective goggles I wear. On rare occasions I do use this, but most of the time I use the cup and paste where you get to pick your flavor and everyone is happy. Lastly, we floss. Floss all the contacts very well. We use the correct technique. You can see my flossing video on how to floss properly. Before you leave, most kids, under the age of sometimes 19, 22, what have you, most younger people will receive fluoride before they leave. There are generally two options. The fluoride trays, which we are showing now, they are great, but you cannot eat or drink for 30 minutes after. The fluoride varnish, which is shown now, is great because you don't have to wait to eat and drink. The only downside to this one is that your teeth sometimes feel a little sticky and bumpy for a while. Okay, now we are done with your cleaning. After your exam with the doctor, you'll schedule your next cleaning appointment, get a goodie bag, and enjoy the rest of your day. So thank you again to Autumn and thank you again to Anna for filming it. Please hit subscribe if you like this video. We're trying this new thing where we do 2 videos a month. I wanted to do like Toothless Tuesdays or something, but that doesn't really sound that good. We don't want to be toothless, so I was going to do the 1st and 15th of every month. I can't really think of a cute tagline yet, so if anyone has any suggestions, feel free to leave them. And until then, we'll see you in another 2 weeks. Peace, love, and teeth.